Okay, to recap, because I realized my other video is running over 15 minutes, YouTube won't let you upload. After I listened to the apical heart rate for a full minute, it was 78. Again, there was even S1, S2, no S3, no murmur was able to be heard. I I felt her radial pulses bilaterally on the inside of her wrist. I'll show you again. Okay. And I'm feeling they're 2 plus, regular. They're not thready, not bounding. Tibial and pedal pulses were also 2 plus bilaterally. Not thready, not bounding. Also noted the color of her extremities. They're not discolored. They're normal for ethnicity. Both are warm equally. And her nail beds on her feet and her hands were good and pink. The next thing I'm going to do, I'm going to move on to the GI part of the assessment. I need to ask her some questions. Alright, you had any GI disturbances like nausea or vomiting recently? Okay. Do you have regular bowel movements?
Yes.
Okay. About how often?
At least once a day.
Okay. The patient says that she denies nausea and vomiting, regular bowel movements of approximately once a day. What was your last bowel movement?
Today.
Last bowel movement was today. And you were 1 month postpartum, correct?
Yes.
How was your delivery? Was it a vaginal or cesarean?
Cesarean.
Okay. So I'm going to be expecting to see some pregnancy-related changes, being that her body is still going back to what it's trying to be. And she did have a C-section, so I'm going to need to assess for a scar. Or in the absence of a scar, that there was an open wound. I'm going to go ahead and look at her abdomen. That's about it. Okay. Alright, can you pull your shirt up just a little bit for me? Okay. Her abdomen, I'm noting, it does not appear distended. There are color changes. The line from the belly button down to the pubic area, and some striae, which we would expect with a postpartum patient. And now I'm going to assess her C-section score. Also, I'm going to kind of look around a little bit more, but I do not see any like lesions or any other surgical marks. Noting there is a tattoo to the right side. The C-section scar is closed and well approximated. There's no redness, no signs and symptoms of infection, drainage. It looks like a properly healing scar. Now I'm going to need to listen to her bowel sounds, and then I'm going to percuss and palpate her abdomen. Bowel sounds present in all quadrants. Percussion is equal in all quadrants. Towards the bottom of her stomach, I can already feel just a little bit more fullness. That's also expected. Of course, her fundal height is still shrinking. It takes, Lord, almost a year for your body to completely go back to normal. So that's expected. That's not something I'm going to be really concerned with right now. I do want to ask her, because of that, if she's had any vaginal bleeding recently. Have you stopped, like, after you delivered, has your bleeding stopped?
No.
So you're still bleeding a little bit?
A little bit. Yes.
Is it like spotting?
The spot, it's not like, it's barely anything.
Okay. Is it bright red, brown?
It's like a red, but it's not bright.
Okay. It's a dark red, not red like frank blood. Do you have any blood clots?
No, not recently.
Okay, no recent blood clots. I'm doing this just to make sure that she's not still bleeding. Most of the time, that's something that you would be worried about immediately post-op, but just covering my bases. Tell me if you're having any tenderness or discomfort when palpating. Okay. Any discomfort, pain?
No.
Okay. The patient denies pain or discomfort to the abdomen. Next, we need to do try to fill the borders of the liver, just to check for maybe like an enlarged liver, anything like that. Do you have any family history of cirrhosis that's not alcohol related or anything?
No, I don't.
Okay. Also, do you drink any alcoholic drinks regularly?
Not regularly, no.
Okay. Alright. I'm going to do this with deep palpation. I'm going to palpate 2 to 3 centimeters down. I'm going to have her take some deep, steady breaths. And as she breathes, I'm going to slowly inch up so that I can feel the border of the liver. Alright, so some deep breaths. Is there any pain or tenderness?
No, it's not.
Okay. As I was going upward, palpate her liver, I was able to palpate on the right upper quadrant. By the way, I was on the right side, mid-clavicular one. I was able to palpate a little bit of firmness up top, right by her rib cage, but I was not able to. What's the word? Predominantly feel the liver borders, which helps to rule out like an enlarged liver that we should be concerned about. And I guess that's about it. Sorry, it went over time.